Welcome to Airway Breathing Conversation, a podcast presented by the anesthesiology residents at the University of Saskatchewan, created to provide individuals of all levels of medical knowledge with anesthesiology-related healthcare information. Join us this week where Jae Newton and Alexander Waslen, third-year medical students at the University of Saskatchewan, and Dr. Anulika Nwakaeze, a PGY2 anesthesia resident also at the University of Saskatchewan, discuss anesthesia rotations during medical school, including specific resources for medical students and ways to get involved in anesthesia outside of the core clerkship rotation. Now, whether you are an anesthesiologist, resident, medical student, or member of the general public, come take a break with our host, Anesthesia PGY2 Sebastian Turcott, and a multitude of brilliant and insightful guests as we demystify the incredible specialty that is anesthesiology, one episode at a time.
Hello, everybody. Hello, listeners. Thanks for joining us for another episode of Airway Breathing Conversation. Super excited to have Dr. Anulika Nwakaeze joining us again, who's one of our soon-to-be R3 residents in our cohort. We're going to be senior residents right away.
I know. I can't believe I'm excited, though.
I don't know how I feel about it yet. No, actually, I'm excited, but it's weird. And then we are happily joined by Alex Waslen and Jae Newton, who are just about to head into their fourth year of medicine here at USask. And we're going to be chatting about anesthesia in med school, sort of how to get interested in it, how to get involved, what to look forward to in some of the core rotations and electives. And we'll sort of be bouncing questions off of each other throughout the episode. Hey, so thanks for joining us, guys.
Thanks so much for having us.
Thank you.
Awesome. Okay. So let's dive right into it. And then we just wanted to start off by saying that as a quick disclaimer, this conversation is strictly based on the four of us, our opinions here. And then others have different approaches to anesthesia, different interests in anesthesia. But I think it's really important just to share our knowledge, our experiences, because it's something that you don't always get a lot of exposure to early on in med school. And I think the more that we can sort of just introduce people to the topic and then they can gain what they want from it, I think is pretty important. So you guys both just finished your third year core rotations in anesthesia, right?
My core rotation was back in the fall.
Okay, so a while ago.
And I just finished mine a couple months ago.
Cool. Okay, sweet. Why don't we start off? Just how did those go? How did you guys enjoy those rotations?
Great. It's kind of a whirlwind of 2 weeks. It goes by pretty quickly, but overall, such a positive experience. I really enjoyed mine.
Okay.
Yeah, me as well. I had a great time. Definitely sticks out as probably the two best weeks of clerkship that I had.
Yeah.
So it's really enjoyable.
Awesome. And so maybe what did you guys gain from it? What did you gain from those 2 weeks? It's a quick snapshot. It's a whirlwind. There's lots of teaching involved. And I guess we should preface that by saying that at USask, there's 2 weeks of anesthesia built into an emerge and anesthesia rotation over 6 weeks' time. So what are some of the skills or maybe some of the things that stuck with you during those 2 weeks that you guys gained?
Well, I would say certainly one of the biggest things I gained is all the technical skills that we get to practice.
Yeah.
So, I mean, I've never had so many reps doing IVs, practicing putting in LMAs, doing intubations, those sorts of things, which I feel like are just great skills no matter what specialty you're interested in, whether it's anesthesia or anything else. They're just great core skills for any physician to have. So just getting to do the reps of those is really awesome. And then just get a much better sense of what the whole perioperative period is from pre-assessment through operations, PACU. I think I got a better understanding of that than just what I could have had from shadowing. So yeah, that was awesome.
Awesome.
I agree with Alex. I think anesthesia is such a unique specialty that we don't get a ton of exposure to in pre-clerkship. So going into it, I didn't really know what to think and what to expect. Kind of just a bunch of unknown, honestly, but lots of practice doing the technical skills, which is always great. And then also lots of teaching, which I really appreciated. Learned a lot from the rotation, took a lot of key physiology points away, which I really enjoyed.
Awesome. I mean, I can definitely piggyback off that as well. Anesthesia was the last 2 weeks of my third year. And so I had zero exposure to it prior to that. But I really loved the one-on-one teaching that you get. obviously the technical skills are very applicable to anywhere. And I think just getting to practice some IVs and different things like that, they're honestly like almost life-saving skills, or bag mask ventilation, some very basic things that you can take with you anywhere. But then also, the discussions around the physiology, the pharmacology, how that applies to different disease processes is really awesome as well. Anulika, do you have anything else? What was your experience like way back in third year?
Yeah, so I did my medical school at the U of A in Edmonton, and I'm a little different in that at the time they didn't offer a core anesthesia rotation. So I had to do a lot of exploration on my own time through shadowing and things like that. So I'm very envious that you guys actually have formal structured teaching here at the U of S. I think it's one of the great boons of the medical program here. But even just through exploring, through shadowing, I've had a lot of the same experiences as you did in third year. I did my shadowing, though, more so in second year for anesthesia. And I loved it. I do think that being able to start IVs, being able to bag mask ventilate a patient or insert an LMA or things like that are very useful skills that can be applied broadly across medicine. So I'm clearly very biased. I love anesthesia.
We all are.
Well, that was my experience. I think it would have been great to have had like structured teaching though as a clerk.
Awesome. And did you guys take any of those skills, some of the teachings that you guys learned, did you apply it into some of your other rotations? So Jae, you started off early in anesthesia. Is there anything that you can think of that you sort of took with you in some of your other rotations and areas in medicine?
I think lots of the communication skills can be easily transferred too. That's something that we didn't really talk about earlier, but being able to gain rapport and gain trust with a patient in the matter of minutes in the preoperative setting, I think that's a skill that my anesthesia rotation for sure taught me. And those skills are definitely transferable to other places. In terms of the more technical skills, I just finished 4 weeks of rural family medicine up north in northern Saskatchewan in quite an isolated community. And my technical skills were definitely used there. Lots of IV skills. We intubated a patient up there, and the doctors are very comfortable with those skills and they do them on a semi-regular basis. But knowing that I had more recently completed an anesthesia rotation, they were happy to have my skills and happy to my limited skills.
Yeah, no, totally.
That being said, but happy that I could be involved in the team.
Amazing. Well, just being able to be a part of it, we all have to start somewhere, right? And so just having that experience is really awesome. And probably having some sort of comfort level from the operating room into that rural setting probably made you feel a little bit more comfortable. I don't want to speak on your behalf, but that's a really amazing experience. So very cool. Alex, you recently finished your anesthesia rotation. So anything that you think you'll take into fourth year or anything that you can think back on?
Yeah, I mean, I was going to say the exact same thing as Jae, that it was rural family that came to mind first, where it was like, wow, a lot of these skills are being used a lot.
Yep.
And also, like Jae said, the soft skills, the communication, the teamwork, that sort of thing is just you can apply anywhere, which is great. I think one other interesting thing that I took away from the anesthesia rotation, which is used on other rotations, is like just the sedation kind of piece of things. Like in the emerge, if they're doing like a sedation on someone with a fracture or something. Not that I was like pushing any of the drugs or anything, but just to be able to talk with the emerge talks about what are you using? Like, are there considerations if they go a little too deep? Like, what's the backup plan? Those sorts of things were pretty cool to see in anesthesia first, and then also get to see in kind of emergent rural family as well.
Totally. And as you progress throughout medical school and inter-residency, you'll find that, for example, sedation strategies, it came up when I did my palliative care selective. It'll come up in the ICU. It'll come up in emerge, like you said. So a lot of these skills and learning points are very transferable across medicine.
Yeah, awesome. And then I think just to plug that even if a medical student isn't interested in doing anesthesia as a residency, at least, I think doing an elective is always worthwhile. I think there's always learning to be had that you can definitely transfer anywhere else, which is really awesome. And so since you guys both finished your core, or you finished your third year, so in third year med school, you complete 6-week core rotations, and then in fourth year, complete your electives. And we were talking off camera a little bit that now the new crop of clerks coming up into third year of med school will be starting their core planning and whatnot. Do you guys have any tips or advice for them in terms of how they're going to plan or structure their third year?
Yeah, Jae and I were kind of talking about this, how we remember being at the end of second year and planning for our third year core rotations. And they give you like all these options for how you can lay out your schedule. You have to pick one based on how everything's going to like follow each other for the rotations. And we both spend so much time thinking about, oh, well, I'm interested in anesthesia maybe, so where should I try to put that block in my rotation? Is it better to do surgery first, internal before that? Should I put it early so I can see if I really like it? And we spent a lot of time tossing up about it, and then just to get to the end of third year, and I think we both kind of feel that it is fine no matter how it turns out, whether you do what you think you're interested in early or later. There's like pros and cons to every schedule, essentially, in terms of what you're doing before what. So to all the upcoming third years, don't worry too much about it if you didn't quite get what you wanted or you're stressing about it. But
Definitely, I completely agree with Alex. That was something that caused me a lot of stress at the end of second year, and trying to figure out the exact schedule and then ending up getting whatever schedule you're given, really, because it's just a lottery. So you can end up with whatever, even if it's not your top choice. Alex and I had very different strategies, or we ended up with very different schedules. I had my anesthesia rotation second in the year, and Alex had his second last. So I think that just goes to show that it worked out for both of us. We're both still interested in anesthesia, despite having very different schedules. And if it's meant to be, and if you like it, you'll like it no matter when it's placed in the year. So
It's a really positive outlook. I think that's a lot of things, especially going through medical training. So much is up in the air, and you can toss and turn, and you can stress about it. And ultimately, it's just at the hands of the medical gods, and whatever happens, happens. But having a positive outlook, I think, is the most valuable thing you can bring to it. And being motivated.
Oh, yeah.
100%.
A lot of it is out of your hands. And so you just have to roll with it sometimes is what I try to suggest to students as well. So that's a great outlook. So now let's say, put yourself back in your shoes before you started your anesthesia rotation. What is something that you would tell yourself going into the rotation that to get the most learning out of it, or to get the best experience that you'd be looking forward to?
I have a mentor and one of the anesthesia residents I'm quite close with, and his advice going in was read the Ottawa anesthesia primer and then read it again once you've read it once. So honestly, I think that there's some such valuable teaching and learning that can come from that. If you're really hoping to get a lot out of your rotation, it's great to put in some work beforehand and read that. But it's also, you can take a lot away from it regardless of what you do beforehand. So
I would say, looking back, something I think is really helpful is to think about questions that you might have when you're one-on-one with a staff, because you get a lot of that time, a lot more than in other rotations. You really get a lot of time just to talk with the staff. And if you don't come in with things that you're interested in or wondering about or have questions, sometimes you end up just kind of watching over the drape and not really getting as much out of it as you could if you had thought about, hey, what are something I read in the auto anesthesia primer that I'm a little bit questioning about or something. And you just kind of think of those questions beforehand, maybe jot a few down, then you can really maximize your 2 weeks, I think.
I still read the Ottawa anesthesia primer sometimes.
I still have it. It's a very helpful resource.
It's on my iPad, and I still look at it sometimes. It's great. It's a great book.
It's so readable too.
It
doesn't feel like a textbook. So
Yes, very true.
Awesome. And so you guys have both been elective planning a little bit. And that's also a very stressful time for med students. And we'll just preface that by saying it all works out, right? And you get what you get sometimes. Have you sort of, how has that been going? Do you have any advice for students that are coming up behind you, sort of on what to expect or how to plan things in terms of their interests after they finish their core rotations?
Like I said, trying to use kind of the same motto it's the same mindset that I had previously, where trying to do as much as I can. We're lucky that we do get to complete some out-of-province electives, which has been exciting to try to plan those. I think Alex and I have both had quite a bit of difficulty trying to get some electives that we're interested in, but hopefully it'll all work out in the end. We'll go from there.
Yeah, I mean, I think one thing that's helped me is to realize, if it's difficult for me to get an elective, it's probably difficult for a lot of people. So I don't think that anybody is singled out in how hard the elective planning process is. It's just kind of across the board for everyone. So you just kind of got to take it as it is, come up with a plan, but be flexible, have the electives that you want to get, and then just keep checking the portal if you're trying to get them out of province every day. Just be on there, take it in stride when you get rejected, and that application money you're never getting back, but at least you tried. So.
Yeah, that's tough. Seb and I went through CARMS planning when COVID was happening. So we didn't have the opportunity to do out-of-province electives. So they're pros and cons to that for sure. It did kind of make it a bit easier to just focus in the provinces that we are in. But there was a recent report that came out that anesthesiology is now the third most popular specialty in terms of CARMS application. So you're so right, Alex. If it's not just you, it's across the country. And I'm sure lots of people are fighting to get these electives. I do think we are going to see it become more and more restricted. Whereas in the past, I think it was 8 weeks that we could do in terms of electives. I think that's probably going to become more narrowed in terms of what's feasible for anesthesia. And programs are going to keep that in mind. Yep. Even if you just get just the 2 weeks or maybe just 4 weeks, as long as, like we've been saying, you have that positive outlook, you are doing your very best, you're reading up on your cases as much as you can, I think that will show by and large that you're very interested in this specialty and that's what you're bringing to the table.
Just to piggyback off of that, like I mentioned, I did my anesthesia core rotation the last two weeks of third year, and then had to switch things around. I only had 4 weeks of electives in fourth year. Luckily, I feel fortunate that it worked out, and I'm super happy to be in this residency program. But just to reassure students that you don't need to do a full 8 weeks. Be flexible with, where you're going. I know other smaller centers can also accept elective students. If you're able to travel a little bit, then that's great. But yeah, like Anulika said, you don't need the full 8 weeks or whatnot. And there's planning around that you can do to sort of help with your application. So,
yeah, totally. Yeah. You can supplement with other things like ICU, internal medicine, family medicine, especially rural, things like that can be super helpful to kind of round out your application.
Yeah. And we just talked about how applicable anesthesia is to everywhere else in medicine. And the same goes for anesthesia applications, is that other rotations are very applicable in your anesthesia rotation as well. Should we flip it around now?
Sure.
Okay. So we thought that this would be fun. So now Alex and Jae are going to start asking us a few questions. And then again, we're just going to have a little conversation based on those questions. So fire away, guys.
For sure. Maybe I'll start us off. I know one question that we kind of had for you both, now that you are residents and have gone through doing electives and that sort of thing, is maybe this is more of a question for you, Seb, having done a core rotation. But how do electives in anesthesia differ from the core rotation in terms of what you feel is expected of you, or did you feel that you changed how you approached the elective versus the core rotation? Or
I think overall the core rotation is so new, and like we discussed, anesthesia, you don't get a lot of exposure to it early on in medical school, especially if you do it late in third year. It's all very, very new. And so I think staff are aware of that you're very fresh. You're just trying to understand sort of the ebbs and flows of the OR, and what does an induction look like? How are we maintaining a patient under anesthesia? What does a safe sort of emergence or extubation look like? And so just being keen, trying to soak it all in is really important in that third year. And then in fourth year, I think as you start to get a little bit more comfortable, I think just taking on a little bit of extra initiative can go a long way. And it doesn't have to be much, like honestly, just having a little bit of airway equipment prepared, helping draw up IVs where you can. Honestly, just asking your staff at the start of the day, like, where can I be helpful? What kind of teaching topics can we discuss today? I think the biggest advice that I received from staff when I was on my electives was that you are not expected to, successffully start every IV that you attempt. You're not expected to successfully intubate a patient on every attempt. And I think the same goes for junior residents. Honestly, I think I still miss an IV every day sometimes. And so those aren't the expectations, either in your third year or your elective anesthesia blocks, but rather learning, being keen, being open to feedback, applying that feedback right away, applying some of the perioperative considerations that Jae was discussing around, what are the patient's comorbidities, and how do I apply that to my anesthetic plan? I think are some of the things that you can start with in fourth year, but aren't even expected to know all yet in med school. Anything else that I missed?
I think that sounds great. Quick plug for website Anesthesia Considerations. It's always a nice, handy thing to review when you are looking up your patients the night before and kind of thinking of how their profile is going to affect your anesthetic management. It's like quick little bullet points, pretty easy to read. And again, if you don't remember everything or if you can't necessarily contextualize everything, that's totally fine. If you pick a point that maybe you do want to read up on further, or like you said, bring up to discuss with your staff, that could really go a long way to show that you're interested and motivated and you're taking ownership for your patients.
That's really helpful. Thanks. Yeah. Do you have any questions, Jae?
Trying to think.
I have another quick one while
Go
you're
for
thinking in the
it.
meantime. I was wondering, as residents now, what are some things that you've learned or seen that anesthesiologists do that you didn't quite get a sense of as a medical student? Because I feel like as medical students, we kind of get a certain window, but we're generally seeing pretty healthy patients, elective surgeries. For the most part, things are going well when we're around because they're not throwing us into all these other places in the hospital that anesthesiologists are. So was there anything that surprised you or that you found that you had a lot more exposure to as a resident than a medical student?
Yeah, I can start for this one. Maybe it's by virtue of not having done a structured core rotation in clerkship, but when I started like day one of residency, I didn't realize that anesthesia was really rooted in all of these anesthetic considerations that we use to generate our plans and adapt them to the specific patient. And I didn't appreciate until I started just how much mental gymnastics that our staff people are doing all the time when they're coming up with these plans and they're managing these patients, and things are changing on the fly all the time. Mm-hmm. And so that's something that I was honestly in awe of, and I still am in awe of going through residency. And it's a skill that you develop as well as you go through the course of training. But certainly when I, have finished my electives in fourth year, I felt so confident. I'd read my Ottawa anesthesia primer. I knew what a Pal and Patty score was and all of that. And then starting residency, realizing that I was completely out of my depth and it was just so much more to the breadth of this practice. So I think that's really one of the just like founding principles of anesthesia is all the considerations that we have to keep in mind and how flexible you have to be to adapt your plans.
Mm-hmm. Yeah, that's great. And one staff put it nicely to me actually during an elective. They said, in anesthesia, you don't necessarily need to know everything about medicine, all the ins and outs, but you do need to know the worst of every comorbidity and how it will affect your anesthetic or how it will affect the patient that's having a surgery that day. And what are the perioperative sort of considerations around that? How can we optimize patients a little bit better, I think is something that I really gained an appreciation for. Because in med school, you do your anesthesia rotation, the patient comes down, they're in the OR, you don't get to necessarily realize all the background that actually went into that patient presenting that day in the OR. For most elective procedures, for a lot of them, patients go to the PAC clinic, the pre-assessment clinic. They get seen by anesthetists and internal medicine physicians there. They're optimized, or for patients who come in a little bit more urgently, then maybe the emergency department is trying to optimize them a little bit more prior to getting to the OR, if it's a trauma or something like that. And I think just gaining an appreciation for the life-saving skills that you develop as anesthesiologists, I think, honestly, it took me a while just to appreciate the importance of a proper bag mask ventilation seal. We talked about it in the teaching and whatnot, and what are the risk factors for somebody who might be a little bit more difficult to bag mask ventilate. And for some of our listeners, that's just able to ventilate a patient using a mask over their face, and how you may not have other airway equipment around you, like an LMA or an endotracheal tube or something like that, but just being able to keep somebody breathing with a bag mask ventilator, is such an important skill that I think every physician should really know how to do well. Mm-hmm. Yeah. So some of those little things that you just pick up on that, and that just comes with experience, right? As you go through residency, you start to pick up on these little things a little bit more. So yeah.
Right.
Another thing I will just add that I gained an appreciation for is how much anesthesiologists do outside of the operating room. I really didn't realize this before, but Seb was just kind of triggering me in terms of we are going to codes and we're going to traumas, particularly here at the U of S. We have really excellent longitudinal exposure to these types of things. We're up on obstetrics doing epidurals. We're at the pre-assessment clinic doing consultations for sometimes really complex patients and trying to figure out the best way to optimize them and get them safely through their surgery. We're doing sedations for endoscopies, things like ERCPs. Truly, anesthesia is all over the hospital. We're not just siloed into the operating room, which I didn't quite have the best awareness of when I was in medical school and I was going through my electives and things. But there's so much to the world of anesthesia beyond just the operating room.
Right, yeah.
Any other resources that you can recommend for people like Alex and I, or people in first and second year who are interested in anesthesia but don't really know how to go about taking that extra step and making sure that they're as prepared as they can be? I know we talked a little bit about auto anesthesia primer and anesthesia considerations already, so thanks for that. Anything else that you can think of that we should be doing?
Kind of like the approach you've taken, Jae, in finding a mentor if you can. And I know mentor can be a bit of an intimidating word, but just going up to a resident, perhaps maybe a more junior resident who's closer to your level of training and expressing your interest. I think we'd all be really excited to meet any sort of clerk that is interested in anesthesia and happy to take them under our wing or just share some of the experiences and tips and tricks that we've developed over our training. So certainly finding someone that you can talk to about what a day in the life of residency looks like, I think is a truly invaluable resource.
Yep. That's a big one. I think shadowing is really important. I think I wish I would have done a bit more shadowing in med school just to get a better appreciation for the different specialties, what they look like. Maybe it would have helped me plan my third and fourth years just a little bit better. And then there's also the anesthesia interest group, right? That I think both of you have been a part of or helped organize events with, which residents go to and help with some of the teaching as well, which is really awesome. And so it helps some med students maybe gain a little bit of exposure that way. And then there's always research opportunities as well. So there's different medical students that will participate in a dean's project here with our department or an associated department at the U of S. Again, just to gain a little bit more experience, get to know some of the faculty and the residents here. So lots of ways to get involved, lots of ways to get more exposure. And again, I think I'll keep hammering this home is that you don't get a lot of exposure early on, and you do have to seek it out a little bit just to really understand if you think anesthesia is the specialty that you want to pursue or not. And so I'm always open to a conversation with somebody just to discuss it in general. You don't have to be necessarily interested, but if you just want to learn more about it, I think any resident in our department would be happy to have that discussion. So, yeah.
Thanks. That's helpful.
It's really great. And we do have lots of our core rotations are the same as rotations that you guys are on off service. So we have opportunities too.
Yeah, no kidding.
I
think I've had more conversations about anesthesia on an off-service rotation than on anesthesia, which is really funny. So, yeah.
On anesthesia, I feel like we're working one-on-one mostly with attendings, like that's who we're scheduled with. And then we have dedicated teaching, which is sometimes led by residents. But some of the most meaningful connections I've made with anesthesia residents are on off-service rotations. So always look out for them there.
Yeah, for sure.
Yeah, that obstetrics call room that everybody just hangs out with. Yeah. Always a good time to bounce ideas off of people. Yeah, that's awesome. Yeah.
That's great.
Anulika, do you have any tips or tricks for medical students who are elective planning for anesthesia? I know we've touched on it a little bit. Maybe you have some sound advice for anybody.
Wow. Okay. Kind of like what I mentioned earlier, it's good to really round out your application because anesthesia, it draws from a lot of different disciplines. There's a lot of internal medicine, there's obstetrics, there's pediatrics, there's geriatrics, there's even palliative care. So if you can arrange electives outside the realm of anesthesia in some of those disciplines. For instance, I did some time in cardiology and respirology. Things like that can really not only enhance your application, but also just inform your own understanding of what this specialty looks like, because it really does have such a wide breadth. And then just like we were mentioning earlier, just be as motivated as you can. I know it's difficult when you're a junior learner, like we are both junior learners for another couple of weeks, but try to take ownership over your patient, meaning try to look them up, have an idea of what they're coming in for, what their clinical course or their surgical course might look like, and how you might adapt your anesthetic plan to best provide safe perioperative care. And even just the basics, like showing up early, asking lots of questions, like you're saying, coming prepared. I think those like founding tenets will apply very, very well to anesthesia elective. And I'm trying to think if there's anything else special that I did. And not necessarily. I know I fought tooth and nail. I did end up getting 8 weeks, but I was also very open to doing rural electives. So I spent some time in Fort McMurray. I spent some time in Lethbridge. Again, I did my med school in Alberta. So if you are able to go to some of those more rural centers, it's great to see how things are done when there are maybe less resources, and also great for building connections like more broadly in the province.
Yeah. I don't have much else to add. I think as well, a trauma elective always goes a long way.
Yes.
I think it's something that I did one in med school, and I found it very applicable to anesthesia. And you do get to be in the OR a little bit as well through that. And then when you are on elective, really just focusing on the basics. Like I mentioned, you're not expected to start every IV that you attempt. You're not expected to intubate every patient 100% of the time. But just focusing on the basics, working on having a proper bag mask ventilation skill, different things like that. And then just being keen, eager to learn is what I usually suggest to students as well. Is that we don't have a magic formula. But just being yourselves and being open to learn is always goes a long way. So
I'll reemphasize what Seb just said. Being yourself, showing off your personality when you're in the OR is so important, because you are going to spend a lot of one-on-one time with your attending. And just being able to hold her conversation and just being a real person in the operating room, sharing your interests. Those are the sorts of things that your staff people will remember. And when you maybe approach them for electives, they will have a bit more of a personal insight into you that they can not for electives, for reference letters, that they can incorporate into the reference letter or just help to remember you more. And the last thing I will add is don't beat yourself up if you're struggling with procedural skills. Like we still struggle with procedural skills on occasion. I could not intubate for the life of me for so long when I was a clerk. And I thought, I can never do the specialty. I can't even get this tube in. Yeah. But it does come. It does click. The more you do it, the more you build that motor memory. So don't beat yourself too much about that. Just focus on the basic principles like Seb was saying, and then just be yourselves. You're clearly motivated, and whomever might be listening to this as well, it's the same goes for you. Just be yourself and show up every day.
That's really great. That's helpful. Yeah, it's nice to hear about focusing on the basics because, you watch somebody bag mask and they explain how to do it, and it sounds like a simple thing to do, and then you go to try to do it, and it's like, oh, I'm not moving any air. Like, what's going on? I'm trying my best.
It's hard. It's not as easy as it looks.
Been there.
The nurses make IVs look so easy too.
Oh, absolutely.
It's not when you try it. No.
Yeah. Just like anything with medicine, it's humbling, and as long as you're willing to learn and being okay with failure is the wrong word, but just being okay with not always succeeding like you thought. It's totally fine. There's lots of learning opportunities, and that's why you have an attending there to look after you. And So thank you very much, guys, for all your questions, for being here with us today. I know this isn't easy, as both of you are just wrapping up third year, thinking about your electives coming up, but thanks. This has been a really meaningful discussion, and I hope some of your colleagues will gain a lot out of it. Now, both of you have quite a bit of interest in the anesthesia interest group, as I take it, right? And so if anybody was looking to be involved or wanting to learn more about anesthesia, do you have any tips or references for them that they can look into?
I think Alex and I, we're both quite heavily involved with the anesthesia interest group throughout our pre-clerkship and also into clerkship a little bit as well. It was one of those things where in the first week of medical school, they provide you with all the options for all the different interest groups. And there's, 50 plus different options of things you can join. And it feels quite overwhelming. But I thought, maybe this was a group where I could fit in. I'm interested in pharmacology. Let's see where this goes. And ended up meeting a close friend. And we ended up having a lot of fun together with the group. It's a great way to be able to make connections with both staff. Dr. Johnson's leading it right now at USask. And made some connections with him, and then also just through all the residents that we invited to help provide teaching and help provide support for skills nights. Also made a lot of connections through there. So I really appreciated it and helped me show my interest in anesthesia and learn a little bit more about what the specialty was about.
Yeah. And shout out to the residents, because you showing up to those events makes a huge difference.
Well, we love it. I mean, we both have an interest in teaching a little bit in medical education. I think the eagerness that the students come with is always really fun. Makes it fun to teach.
And it's like coming full circle. It's like, wow, I finally learned the skill enough to be able to teach it.
Yeah, I know.
This is incredible.
I guess another quick plug, Dr. Alex Pellerin, who's been a host on our podcast. She's always studying right now and crushing that, and she'll be writing her exam soon. She also runs the Airway Breathing Coffee website that has lots of amazing resources for medical students to read up on. They're mostly infographics on some of the, they're broken down into different topics in anesthesia that are really easy to read, really easy to understand. And so if anybody has an upcoming OR during a rotation or something, maybe they can gain something from there to start a conversation with the staff or just learn a little bit more. So another quick plug of some of the initiatives going on in our department.
And speaking of conversations, the Airway Breathing Conversation podcast is also an excellent resource if you're looking for more things out there.
Yeah.
Awesome. Okay. Well, thanks so much for joining us, guys. Thank you, listeners, again for joining us for another episode. And we will chat with everybody again soon. See ya.
Take care.
Thank you for having us.
Of course.
You've been listening to Airway Breathing Conversation, a podcast hosted and presented by the anesthesiology residents at the University of Saskatchewan. Please note that while this podcast is run by healthcare professionals, it is intended for educational and entertainment purposes only. We are very thankful to our guests for taking the time to share their wisdom with us this episode, and a very special thanks to you, our listeners, for tuning in. Don't forget to follow us and our associated USask Anesthesia accounts on social media. You can find all our social media links on our Linktree page at linktr.ee/abc_podcast. You can also find the department's social media links on their Linktree page at linktr.ee/usask_anesthesia. We'll see you next episode, but until then, stay calm, take a breath, and always remember your ABCs.